Let's talk about the female genital organs and functions. We have the external organs and we have the internal organs. The vulva is the outside part of the female genital, which includes the labia that protects other parts. It helps keep everything healthy and working properly. Here are some parts of the vulva. The mons pubis, a soft fatty area above the vulva that helps protect it. We have the labia majora, that is the thicker outer lips that keeps everything safe and cozy. And then we have the labia minora, the thinner inner lips that helps keep the vulva clean and dry. We have the clitoris, a small sensitive spot that feels good when touched. And we have the vestibule, it's the area between the labia minora where some other fluids come out. And the perineum is the skin between the vaginal and the anal opening. Then we have the internal organs. Inside, there are ovaries that produce eggs and hormones. The uterus is where a baby grows, and the vagina is a tube that connects to the outside, allowing for birth and menstrual flow. And then the female genitals has three openings. So, and we have the urethral opening that links the bladder to the outside. We have the vaginal opening that links the uterus, that's the womb, to the outside. And we have the anal opening that links the rectum to the outside. So the pelvic floor is a group of muscles at the bottom of a woman's belly. These muscles help hold important organs like bladder and uterus in place. They also help with bladder control, bowel function, and sexual health and childbirth. These are the components of a pelvic floor. The pelvic floor muscles, they stretch from the pubic bone to the tailbone and act as a support system for your pelvic organ. They help keep everything in place and allow you control the release of urine, stool, and gas. And then we have the connective tissues and ligaments. These tissues connect your pelvic organs to the pelvic bones and help hold everything in place. Then these are the organs that the pelvic floor supports. It supports a lot of organs. So we have the bladder. The bladder stores urine until you are ready to go to the bathroom. So when your pelvic floor muscles are strong, they help control the release of urine by supporting the bladder and closing the urethra. It is the tube that urine passes through. The urethra is the tube that urine passes through. Another organ that the pelvic floor supports is the uterus, that is your womb. So the uterus is where a baby grows during pregnancy. The pelvic floor supports the uterus, helping to keep it in position, especially during pregnancy when it's under extra strain. And then we have the bowels. Your bowels, that is intestine and rectum, help process and eliminate waste from your body. The pelvic floor muscles help control the release of stool and gas, giving you control over your bowel movements. And these are the functions of the pelvic floor generally. They support, as in they hold up your bladder, your uterus, and bowels, preventing them from sagging or pressing down, a condition which is known as pelvic organ prolapse. So it supports these organs and preventing them from sagging down. So when they sag down, we call that prolapse. And then control, it helps with bladder and bowel control, allowing you to release urine or stool when you are ready and preventing leaks, urine leaks. So we have sexual functions. The pelvic floor plays a role in sexual function, helping with sensation and satisfaction. And then we have childbirth. During pregnancy, the pelvic floor supports the growing uterus. And during childbirth, it stretches to allow the baby pass through. So taking care of these muscles is very important for feeling good and staying healthy as you grow older. So, and strengthening these muscles through exercises can help prevent issues like incontinence and prolapse and improve overall core stability. And these are some signs of pelvic floor dysfunction. We have urinary problems, difficulty starting urination, or frequent odors. or painful urination or leakage during activities like coughing or laughing. Then we have straining during bowel movement or a sensation of incomplete emptying or evacuation, as in you've went to the toilet but feel as if something is still left. Then we have pain, discomfort in the pelvic region, lower back pain, genitals. Women may experience pain during intercourse. And then we have muscle spasm. That's the involuntary contraction. As in, when they say something is involuntary, it's not under your control of the pelvic area, leading to discomfort and painful sex in some women. And then we have pressure or balding. This normally is more common when women have pelvic organ prolapse. They say they have a feeling of heaviness in the pelvic or a visible bulge. So, and common pelvic floor dysfunctions and how to treat them. So we've discussed the signs. Those are the signs: urinary problem, this, and so now if that is given a diagnosis, that is when we call it a dysfunction already. So now they have a diagnosis. All those symptoms we mentioned are initially, they can be temporal, they can be permanent. But if it's taking longer, then we can call it a pelvic floor dysfunction. But there are some times when you eat some food or anything that can trigger maybe urine leakage or any of these things, the signs I mentioned initially. So common pelvic floor dysfunctions are urinary incontinence, as I stated, and the causes are weak pelvic floor due to pregnancy, childbirth, aging, obesity. And these are how you can prevent urinary incontinence: by maintaining healthy weight. When you have a good weight, not too obese, it helps prevent urinary incontinence. And then you perform regular pelvic floor exercises. And then I want to mention that Kegel is the most basic form of pelvic floor exercises. So when you go to a physiotherapist and you are told you will be performing pelvic floor muscle training, Kegels are just the starting point. There is more to pelvic floor muscle training than Kegels. So, and then treatment options that are available are pelvic floor therapy, just as I stated now, bladder training, medications, and in severe cases, you might need surgery to treat urinary incontinence. And then another form of common pelvic floor dysfunction is pelvic tightness. That is, it usually manifests as pain. It's caused by stress, anxiety, or maybe history of trauma. And then you can prevent it by practicing pelvic floor relaxation techniques to reduce the stress. And then if it's severe, you will need to meet a pelvic floor therapist to get treated. Like people that have vaginismus, when they get married, it's difficult for them to have intimacy, or those that have dyspareunia, they have severe, constant, painful intimacy. Those, they will need to see a pelvic floor physiotherapist. But if it's something that is just intermittent, then you can perform pelvic floor relaxation exercises to ease these symptoms. And then other treatment options might be manual therapy to relieve tension, and that manual therapy can only be performed with by a pelvic floor physical therapist. Another pelvic floor dysfunction that I've mentioned initially is the pelvic organ prolapse, and its cause is also weakness of pelvic floor muscles, and you can prevent it by practicing those exercises. And then there are some non-surgical treatments, and in some cases you may need to go for surgery. And then we have vaginal flatulence. The causes of vaginal fat, that is flatulence, that is fatting from the vagina, is also known as is queefing, are completely natural, but they can sometimes feel uncomfortable or embarrassing. They occur when air gets trapped in the vaginal canal and is released during movement or intimacy, so producing a noise. While this is usually harmless, it can be more frequent after childbirth, pelvic surgery, or due to weakened pelvic floor muscles or vaginal laxity. So, ways to prevent vaginal flatulence is strengthening the pelvic floor through Kegel exercises, deep core breathing, adjust your position and avoid positions that make it worse during exercise, and try to engage your core and pelvic floor muscles when in certain positions to minimize air being trapped in your vaginal canal. And then the treatment is, of course, physical therapy to improve your muscle tone and control. And then the last one The last one of the most common pelvic floor dysfunctions is constipation. So, and dysfunctions of pelvic floor can hinder the proper bowel movements due to straining and lack of coordination. And then you can prevent this by maintaining a high fiber diet, staying hydrated, and practicing regular physical activity. So when you move around, the more you move around, the easier it is for you to have more smooth bowel movement. So walking is one easy way. And then there are some exercises too that helps. Hydration too helps with constipation. And then treatment options include dietary changes, yes, and then biofeedback therapy or muscle coordination, and medications if necessary. So addressing all this dysfunction early with appropriate intervention can improve your quality of life in many ways. So what are the pelvic floor exercises that can ease all these symptoms and dysfunctions I mentioned initially? Then we have Kegels. But what are Kegels? And why should or shouldn't you do them? First of all, Kegel is a pelvic floor contraction. As simple as that. So Kegel exercises are simple yet effective way to strengthen your pelvic floor muscles, which support the bladder, bowel, and the uterus. So who should be doing Kegels? Not everyone should be doing Kegels. Yeah, that might be surprising. If you have pain in your pelvis, example of pain during sex, pain in when sitting, urinary or bowel urgency, or pain while performing Kegels, then you likely need to do the opposite of Kegels and focus on relaxing the pelvic floor. Because if you have these symptoms, Kegels can make your symptoms worse. So if you have a healthy pelvic floor with no issues, then Kegels are great to maintain pelvic floor strength, endurance, and functions. If you have symptoms of weakness, typically like urine leaking or feeling pelvic pressure or vaginal fats, then Kegels may be great for you to start to strengthen and gain tone and support your pelvic floor. So, how to perform Kegels exercises correctly? This is a simple way to perform Kegels. The first step is for you to identify the right muscles. Find your pelvic floor muscles. Try to stop urination midstream or tighten the muscles you would use to avoid passing gas. The next step is to get comfortable. You can do Kegels while lying down, sitting, or standing. Beginners may find it easier to start lying down. So then you perform the exercise. You squeeze and hold the pelvic floor muscles for like 1 to 3 seconds. Then you relax for the equal amount of time. If you squeeze it and hold it for 1 second, you relax for 1 second. If you squeeze it and hold it for 2 seconds, you relax for 2 seconds. Then aim for 10 to 15 repetitions. Then perform at least 3 sets a day. So if you start with holding with one by contracting it for 1 second, with time, as you find it easier, you might increase the duration of time for which you hold and relax. So, and then let me ask, are you doing Kegels correctly? Many people don't do Kegels correctly, even when they think they are. We can't see the muscles and typically don't have good awareness of them. So, it's not surprising that most people struggle with Kegels. So, if you're having a hard time feeling Kegels, start by practicing while lying down. This is typically the easiest position. You need to first focus on coordination. Just get the contraction and relaxation done correctly under your control first before you start to do variation of Kegels. So once you can do it correctly in lying position, then practice it in sitting and standing or any other position where you have symptoms. This is how to progress Kegels. So try these cues for your practice. Maybe it will help you be able to locate those muscles faster. Like squeeze there, like they are stopping the flow of urine. Squeeze like you are pulling, squeeze like you are pulling your seat bones together. Squeeze like you are holding back gas. Then fully relax pelvic floor after each contractions. Do the opposite as the Kegel to relax. For example, when you are relaxing, you think about releasing gas. When you are contracting, you are thinking about holding back gas. And then when you are contracting, you are thinking about closing up your vagina. And when you are relaxing, you are thinking about opening up your vagina. So these are the things you shouldn't do while performing Kegels. So don't use the wrong muscles. It's easy to mistakenly engage the wrong muscles like your abdominal muscles, that's your tummy muscles, your buttock or thigh muscles instead of your pelvic floor. This reduces the effectiveness of the exercise and can lead to unnecessary strain. So focus on isolating your pelvic floor muscles, the ones you use to stop the flow of urine. So avoid tensing your abdomen, that is your tummy, thigh or buttocks. Another thing you should not do is do not hold your breath. No one should be able to tell you are doing this exercise. Many people hold their breath during Kegel exercises without realizing it. This can cause additional pressure on your pelvic floor and reduce the benefits of exercise. So, breathe normally throughout the exercise. Inhale when you relax the pelvic floor and exhale as you engage them. And then don't overdo it. Overworking your pelvic floor muscles can lead to muscle fatigue, even tightness, which can cause discomfort or pelvic pain. Kegels can be done in moderation like any other muscles exercises, and then you have to start with short sets of contractions a few times a day, and then you gradually increase the intensity over time. Avoid performing Kegels constantly throughout the day. So don't squeeze too hard. Squeezing your pelvic floor muscles too hard can lead to muscle tension rather than strength. The goal is controlled, gentle contractions that allow the muscles to work effectively without straining. So focus on controlled contractions, holding the squeeze for 5 to 10 seconds before releasing for an equal amount of time. The squeeze should feel firm but not forced. Don't do Kegels while urinating. Some people mistakenly believe that stopping their urine mid-flow is a good way to practice Kegels. However, doing this frequently can lead to incomplete bladder emptying and increase your risk of urinary tract infections. So only use the urine stopping technique to identify the pelvic floor muscles, not as regular Kegel practice. And then don't expect instant results. It takes time to build pelvic floor strength, so don't expect immediate improvement in symptoms like urinary incontinence or pelvic dysfunction. So be patient and consistent. It may take several weeks to notice improvements. Set a routine, but don't get discouraged if results aren't immediate. And don't ignore your pain or discomfort. Pelvic floor exercises should not be painful. If you feel discomfort or pain while performing them, it could be a sign that you are doing them incorrectly or that your pelvic floor is too tight, a condition we call hypertonic pelvic floor. So if Kegels cause pain, stop and consult a pelvic health professional. You may need an individualized exercise plan, and don't forget to relax. Just as is important as contracting your pelvic floor is relaxing the muscles between the repetitions. So constant tension without relaxation can lead to tightness, which is counterproductive. So always take time to fully relax your pelvic floor between contractions. This allows for balance strengthening and prevents tightness. And don't rely on Kegels alone. While Kegels are great for pelvic floor strengthening, they shouldn't be the only exercise you rely on. A balanced approach with core strengthening and other pelvic floor friendly exercises will give you better results. Complement your Kegels with deep core breathing, Pilates, or other exercises that support pelvic health. So what are the benefits of Kegel exercises? They improve your bladder control, they enhances your bowel control, they support your pelvic organ health, they improve your sexual function, they improve your stability, that is, they stabilize your pelvis during your daily activities, and they improve blood flow for healing and long-time pelvic health. This is especially important for new moms, increasing blood flow to that area for healing. So, and then improve awareness of the pelvic floor muscles to know when you are relaxing and contracting. And what are the best time? You can perform them right after waking up. You can perform them during your meal time. You can perform them when you are on transit. You can perform while watching TV, and you can always make sure it's part of your routine to perform before going to bed. So when you have a static time that you perform it every day, it's more likely for you to stay consistent. And one good thing about Kegels is nobody would know you are doing it. That is, if you are doing it correctly. So let's talk about the connection between the pelvic floor and the abdominal muscles. Do you know the pelvic floor and the abdominal muscles are closely connected and form part of what we call the core? The core isn't just your abs. The core isn't just your abs. It's a group of muscles that includes your pelvic floor, the diaphragm, that is the muscle we use for breathing, and your deep abdominal muscles, as well as your back muscles. So these muscles work together to support your spine, stabilize your body, and help you perform everyday movement. So when your pelvic floor is weak, it disrupts the balance of your core, leading to issues like back pain, poor posture, and even low energy, because your body is working harder to compensate for this imbalance. So the core and breathing. A strong core isn't just about strength exercise, it's also about learning how to breathe correctly. Your breathing patterns directly affect your core and pelvic floor function. So on each inhale, as you take in the air, as you breathe in, your diaphragm moves downward and your pelvic floor and abdomen should expand naturally. And as you exhale, that is when you take out air, your diaphragm moves upward and your pelvic floor should lift as your abdominal muscles gently contract. So this breathing coordination helps to engage your core properly and can lead to a more efficient and energized body. So, and strengthening your pelvic floor has a direct impact on your energy levels. A weak pelvic floor leads to core instability, causing your body to work harder just to maintain basic posture and movement. This extra effort drains your energy over time. By strengthening your pelvic floor, you support your entire core, reduce strain on other muscles, and increase overall stability. This means your body can move more efficiently and you feel less fatigue. Proper core function also improves circulation, supporting better oxygen flow and energy throughout the day. So another exercise are deep core breathing exercise, and this is how to perform it. You sit or lie down comfortably. You inhale deeply, expanding your belly, that is with one hand on your chest and one hand on your belly, and you exhale slowly, pulling your belly button towards your backbone. So, and you perform this exercise for like 5 to 10 minutes daily to strengthen your core and pelvic floor. And then another exercise is pelvic tilt. So this is how to perform pelvic tilt. You lie on your back with your knees bent and feet flat on the floor. So you gently tilt your pelvis upward, tightening your abdominal muscles, and you hold for a few seconds, then release. Repeat 10 to 15 times. So this helps engage your core muscles and strengthen your pelvic floor.